Hello, welcome friends to this session of Facebook live chat. So today the discussion is about tubal block. What are the tubes? What am I referring to? These are fallopian tubes which connect the ovary to the uterus. So let us first understand what is the function or what is the role of fallopian tubes in reproduction, or how do we achieve a pregnancy. So, as I said, the fallopian tubes connect the ovary to the uterus. So, when a mature egg is released from the ovary every month, it is picked up by the fallopian tube, and then slowly the tube moves, the egg slowly moves down the tube towards the uterus. When there is a sexual contact or intercourse, sperms are deposited in the vagina, and from here the sperms swim up, enter the uterus, and then enter the tube, and then fertilize the egg. This fertilized egg, where a new life is now created, we call it embryo, now slowly moves from the tube into the uterus, and if it gets good environment and it implants, a pregnancy starts. So what happens when the tubes are blocked? So two things can happen. Either the egg is not picked up from the ovary at all, if the tube is blocked at the end, or if the tube is not blocked at the end, it is blocked somewhere in the middle, then the egg comes into the tube, but its further movement is stopped somewhere wherever there is a block. Now, if these sperms are able to reach through that block, because sperms are much smaller than the egg, then what will happen? The fertilization will occur in the tube, but now this embryo cannot move further because of the block, and it can result in an ectopic pregnancy. So, to achieve a natural normal pregnancy, we need at least one, if not both tubes to be open. How do we diagnose that tubes are blocked? There are two standard methods. One is done in the X-ray department. We put the patient on the X-ray console, and then we inject some radio contrast dye from the cervix. This goes into the uterus, fills up the uterus, and then spills out into the abdomen through the tubes. And we can see the movement of this dye on X-rays. So this is called hysterosalpingogram. The other method is to do it on ultrasound. In this case, we put some water from the cervix, and then we see whether this water comes out of the tubes, and that is checked on ultrasound. Besides these two methods, if a laparoscopy is done for whatever reason, either for infertility or for some other reason, then the tubes can be checked by putting a colored dye through the cervix, which you can see with your own eyes. You can see that the tubes fill up, and then the blue colored dye spills from the end of the tube, which is inside the abdomen. So, once we have a diagnosis of tubal block, what are the treatment options we have? There are primarily two options. Either we go for surgery or we go for IVF or test tubing. So, what is the kind of surgery which is done? Surgery has become now much more easier or patient friendly than older days when we used to give a big cut on the tummy. Now we make small 5 to 10 millimeter cuts to put the telescope in, and through another cut we put an instrument with which you can hold the tube and check it out. On laparoscopy, we first confirm whether the tubes are open or not, because sometimes an HSG may show that the tubes are blocked, but when we actually do a laparoscopy, we find that the tubes are actually open. If the tubes are blocked, then we first assess the tubes whether they look healthy or they look diseased. Because if the tubes are diseased, there is no point opening these tubes surgically. You will still not get a normal pregnancy. If at all pregnancy occurs, there is a higher risk of getting an ectopic pregnancy. Ectopic means that the pregnancy is inside the tube, which cannot grow to a normal baby, and we have to actually do surgery for that. So we look at the tubes, and if the tube looks generally healthy, then we see where is the block, and depending on the block, we may be able to open the tubes by surgery at the same sitting. When we are checking it, we can open the tubes also. If the tubes are blocked and cannot be opened on surgery, or if one chooses to go for IVF straight away, then IVF is a good option, because in IVF we do not require the tubes or the patency of the tubes to achieve a pregnancy. Interestingly, IVF was invented in the first place for those women in whom the tubes were blocked and they could not get pregnant. So IVF bypasses the tubes, and straight away we put a fertilized embryo into the uterus. The question arises, if the patient knows that she has blocked tubes, should you go for surgery or should you go for IVF? So one simple rule is that we look at the age of the patient. If the patient is young, if she's 25, less than 30, then we want to do a laparoscopy to check out whether the tubes are really blocked or not, and we also make an effort to open them surgically. The advantage is that the patient is young. If you can open her tubes by surgery, then she can have 1 or 2 or 3 children, as many as she wants, naturally. She doesn't need any other treatment if there is no other problem with her. If somebody has had surgery and she still does not get pregnant, let's say she tries for 6 months or 1 year depending on her age, and she does not get pregnant, or in the meantime she does the HSG or another test again to see whether the tubes are open or not, and you find the tubes have got blocked, doing the repeat surgery is never a good idea. The chances of getting a normal pregnancy are best after the first surgery. So these patients are better with IVF treatment. Or if the patient is older than 35, then we give a choice to the patient, but we prefer to do IVF for the simple reason that if you do surgery, open up the tubes, then you still have to wait for 6 months to 1 year to try and achieve a pregnancy naturally. And as the age increases, the pregnancy rate goes down, whether the pregnancy is natural or by IVF. In both cases, age is a very important factor which determines the success of achieving a pregnancy. So after 35, we do not want to wait very long. And in fact, if you see the pregnancy rate per cycle, it is much higher with IVF than with a natural conception. So as age is increasing, we would like to go for IVF rather than give her a surgical treatment and then wait for her to conceive. Because if she does not conceive after surgery, after 1 year or 2 years, then the chances of her getting pregnant with IVF also are much worse than if she had gone for IVF in the first place. So tubal block, dear friends, is an important factor, particularly in India, in rural setups where there are lot of infections, sexually transmitted infections, and if they are not treated well, then these infections can lead to tubal block. So it is important to check out the tubes when we are investigating infertility, that means why somebody is not getting pregnant, and then move on to the appropriate treatment. Because many times it happens that sometimes patient visits one doctor and she gives her some tablets to get pregnant, and then she goes to another doctor, then she again takes treatment for 6 months, 1 year, and without checking the tubes. And after 2 years, you find that the tubes are blocked, and all this time has been wasted because she could not have achieved pregnancy with blocked tubes. So it is important, it is one of the primary investigations in infertility, that we must know the tubal status, that the tubes are open and patient can get pregnant naturally. Thank you. I would like to see if there are any questions. So there is a question from someone, she says, ma'am, I have two back-to-back miscarriages after conceiving by IVF in last September and December. Please suggest what can we do, though I have diagnosed lupus positive. Okay, dear honey, like there are two important factors. One is your age, which you have not mentioned, because it is important to understand that as we get older, the chances of miscarriage increase. The explanation is that as we get older, the egg quality goes slowly down and we form more abnormal embryos. So either one doesn't get pregnant, or if you do get pregnant, then the sort of nature rejects this abnormal embryo because it will grow into an abnormal baby. So there is a miscarriage. So it could be related, one, to your age, and the other factor which you have said is lupus. Lupus also reduces the chances of getting pregnant as well as increases the chances of miscarriage. But with lupus positive, if you are given appropriate treatment, like we give some injections, some blood thinners, and other medicines also which you are taking for lupus must be continued, then you may still be able to continue your pregnancy in the next time. So you are 30 years, that is good. So you need to actually talk to your doctor that if getting pregnant is not a problem, maybe in the next pregnancy you could be put on injections of blood thinners and you may be able to. The other thing is the lupus should be in remission. If the lupus there is showing high activity, then also there is increased risk of miscarriage. Yeah, if you have made blastocyst, that means that your egg was good quality, reasonably good quality at least, so that because it has grown to blastocyst, so then there has to be some problem either related to lupus. So you need to consult your physician and make sure that your lupus is in remission, and then your gynecologist or obstetrician who is taking care of pregnancy, that you need to start the injections. In fact, we start even when we start do the embryo transfer, we start injections so that miscarriage does not occur. And sometimes if the lupus activity is very high and if there is a problem, then maybe you need to go for a surrogate. So you need to discuss, because unless I see all your investigations, I cannot advise you any further that why are you having miscarriage, because there are so many factors which need to be addressed. Well, lip therapy I would not suggest, because lip therapy is something which is not proven scientifically. Doctors try a lot of things because, like, you are desperate, doctors are also desperate to get your pregnancy to continue. But lip therapy is not scientifically proven and it can also have some harm. So I would not suggest that. Okay, so thank you very much. And those of you who are attending, like I said earlier, if you want a particular topic for me to discuss or take up, then I'm happy to do that. Please send us feedback on Miracles IVF. Thank you.